Sinus arrhythmia is the variation in heart rate with respiration. So, interestingly enough, when we inspire or breathe in, our heart rate increases. And when we expire and breathe out, our heart rate decreases. And that is a function of a change in the sinus node's pacing of the heart, right? So we learned about how the sinus node is the pacemaker of the heart. And this lecture is going to talk about some of the physiology behind some of the nervous system control over that sinus node rate, specifically the autonomic nervous system. Now, the autonomic nervous system comprises, there's two branches that comprise the autonomic nervous system. There's the sympathetic and the parasympathetic. Those are two competing nervous systems. So the sympathetic is our fight or flight. The parasympathetic is our rest and digest. And interestingly, these two different nervous systems are impacted by inspiration and expiration. We're going to talk a little bit about the physiology. So first thing I want you to do is when I look at this rhythm here at the bottom, there's going to be one thing that I really want you to notice. You'll notice that the rate here initially is a bit slower, and then it briefly picks up in pace. We see it get a little bit faster. And then you see the rhythm slows down again, right? If we look closely, we see this QRS lands on a solid line, and we get a rate of 300, 150, 100, 75, 60, somewhere between 60 and 75. We'll say 65 beats per minute. And then you see it speed up to maybe, if I start here at this beat, and we go backwards, 300, 150, 100, 75, somewhere between 75 and 100, but closer to 100. So I don't know, maybe 90 beats per minute or so. So you notice that there's a variation in the heart rate just right next to each other. And this heart rate variation, you can see, is driven by these sinus P waves. So here's our P wave conducting to QRS, P wave to our QRS. And if you scan through, you notice that it's the sinus node that is driving this rhythm. So we know that the heart rate changes are coming as a function of changes to the sinus node's rate, right? When we look at our heart, we see we have our sinus node that, remember, sits high in the right atrium and is the pacemaker node of the heart. And when it does so, when the sinus node is pacing the heart, we get those atrial P waves that then conduct through the AV node into our ventricular conduction system to generate that QRS complex, right? And we see just that in this rhythm, our P and QRS complex being coupled together. So we know it's a sinus rhythm. And now we have something called sinus arrhythmia. And that's the variation in heart rate with inspiration and expiration. Let's talk about it. So here we have two diagrams of lungs. One we have inspiration, one we have expiration. And we're going to talk about what happens with each and how that directly affects hemodynamics and thus the autonomic innervation of the heart. So first thing we're going to look at is inspiration is here. Inspiration. And remember that inspiration is when we breathe in. And what happens when we breathe in? Well, our thoracic cavity rather needs to get larger. It needs to create a negative pressure vacuum effect to drive air in. So how does it do that? We see the diaphragm here at the bottom flattens out. That diaphragm flattens out. And our intercostal muscles expand the ribs. So we get expansion of the ribs, creating a larger volume within the thoracic cavity. Ultimately, the goal here is to decrease the intrathoracic pressure. By decreasing the pressure within that thoracic cavity, you get a pressure gradient, which then allows for air to come in from the external environment, right? So we get air coming into the lungs. And that's what drives air in inspiration. Now, what's also inside of the thoracic cavity? The heart, right? Notice I put our nice heart diagram here. So if our heart is also within the thoracic cavity and there's a negative pressure within the thoracic cavity, there's also a slight decrease in the pressures here within the heart. And what does that do? It drives venous return. So it actually increases venous return to the heart because now there's less pressure in the blood cavity within the heart's chambers. And so we get improved pressure gradient, so we get more venous return to the heart. As a result of that, what happens? Well, the right atrium, which receives that blood, it fills up more, right? It's got more blood. It's like a bolus of blood. And there are some special sensory receptors that can sense that new pressure change, that stretch in the atrial myocardium. And that sends signal back to the central nervous system saying, hey, we've got more blood. And what ends up happening is the autonomic nervous system picks up that signal and goes, okay, we need to obviously beat faster to push the blood forward. So you get a compensatory increase in sympathetic fibers, those fibers that are from the sympathetic nervous system, that are those fight or flight kind of adrenaline system. They kick in to increase the heart rate. Now, something that I didn't mention earlier is that sinus node is heavily impacted by the autonomic nervous system. So that sinus node gets that increase in sympathetic innervation and brings the heart rate up a little bit higher. And so that's where you see faster heart rates with inspiration. So that's the physiology there. And now let's move over to expiration. When we expiration, when we expire, the exact opposite occurs, right? So the thoracic cavity collapses back down in an effort to increase pressures, right? Our diaphragm retracts back, our ribs collapse back down, and that ultimately increases the pressure in the thoracic cavity so that we can, drive air out. As a result, you get an increase in pressure within the blood chambers of the heart, and that venous return goes down. So we have decreased venous return. And with decreased venous return, you have less stretch within the atrial myocardium, and the heart goes, okay, let's let the central nervous system know. And the central nervous system says, okay, we don't have as much blood flow. We don't need to pump as fast. And so the way it does that is it decreases that sympathetic tone. And by decreasing the sympathetic tone, you essentially are getting an increase in the parasympathetic tone, right? The parasympathetic tone, which is, whenever the sympathetic tone is high, it overrides the parasympathetic tone. But now, since it decreased, this becomes the dominant aspect of the autonomic nervous system, which slows that heart rate down. And so notice, as it gets slower, this is with expiration. So when we breathe in, pressure goes down, blood flow increases because of that pressure gradient, and then our heart rate speeds up. And then when we expire, pressure increases, blood flow returns, slows down, and therefore we don't need to pump as fast, so the heart rate slows down. That is all a function of the autonomic nervous system as it innervates that sinus node, and this phenomenon is called sinus arrhythmia. Now, sinus arrhythmia is a normal occurrence and is most often seen in folks with a very high intact parasympathetic system, right? So young athletes, people with low resting heart rates that are typically kind of younger and healthier. So this can be a normal finding, and notice it happens every 3 seconds or so, right? With inspiration, expiration. So breathe in 12 to 20 times per minute, you should see a change at the same rate. So pretty interesting. I think it's a great lesson on physiology, and hope you enjoyed, and see you in the next lecture. Take care.